Hello everyone, my name is Stefano Zuberi and today I'm gonna present you a video or media presentation backing up my placement reflection assignment that we have in the near future for the module of SPO 327 Sports Rehabilitation Therapy. So before I talk about my presentation, I would like to present you a little bit of background of myself, just because I really believe that is relevant about how I started my journey, how I chose the program that I'm into right now, and how I have progressed. So I was born and raised in Greece. English is not my first language, so it was a difficult decision for me to make to study in another language. Came to the UK so I could study sports rehabilitation and therapy at the University of Sunderland. I used to play basketball in the semi-professional division. So when I was 17 years old, I had my ACL ruptured and I did a surgery afterwards to replace it. And then I returned to compete in basketball after 9 months of my surgery. So why I think this is irrelevant? This is relevant, sorry. I believe it's relevant because after I did my surgery, I started physiotherapies after 2 weeks of my surgery, and I really liked the journey that I was on with my physiotherapist, and that was the journey that made me decide that I want to be a sports physiotherapist. So basically, sports rehabilitator is even better than physiotherapist. Um, so yeah, so a bit of introduction of the course. Sports Rehabilitation and Therapy program aims to equip students with the knowledge, skills, and clinical experience necessary to assess, treat, and rehabilitate athletes' injuries, as well as to optimize athletic performance and promote overall health. So, in this program, what it what it focuses on is the theoretical knowledge, which is the advanced understanding of anatomy, physiology, the biomechanics of the human body, strength and conditioning relevant to sports injuries, and then exploration of therapeutic modalities, rehabilitation protocols, and evidence-based practices in sports rehabilitation. Afterwards, we have the practical skills, which is practice in utilizing therapeutic modalities such as manual therapy, therapeutic exercises, taping to facilitate recovery and enhance performance. Also, there is hands-on training and assessment techniques for sports-related injuries, including range of motion testing and strength assessments. And last one, professional development. This course emphasizes on professional standards and ethics, communication skills and professionalism in working with athletes and coaches, and then opportunities for continued learning, professional networking and career development. So, uh, the first year that I was on placement, as I remember, we were on the performing arts students. That was my first year placement, basically my first placement of this journey. Each sports rehabilitation and therapy student was assigned to a performing arts student. The scope of this placement was to assess our assigned student and help them recover from their injuries. We were there about 6 weeks, and every Monday we had a session of 2 hours. In first we watched their warm up and sometimes even joined them, and afterwards we were working with the performing arts students so we can make them recover from their injuries or even more help them and promote overall health. So my case study was an 18 years old female performing arts student, and she had two different injuries which were in the ankle and the knee. So as I remember, on the subjective assessment, as always, I introduced myself and tried to make the patient feel confident around me. Then I started asking questions about her injuries, like the history of the patient with performing arts. I asked her about her journey, how how she chose performing arts, why she liked performing arts. These were questions more to feel confident with me. Then I started asking for the history of injuries, if her ankles, if her ankle was injured again or her knee. And as I remember, she told me that she had multiple injuries, and then how long ago the injuries were, and if she has done any rehabilitation about them. So as I remember, the patient had a really swollen knee and her ankle as well. As I remember, she didn't take part any of the sessions that they had, so we were working on them all around. The thing is that just because I was very nervous, because obviously the communication barrier is over there, because my first language is Greek and not English. I was feeling very nervous at the beginning, but I really tried to make her uh, feel confident around me. And afterwards, we did an objective assessment on her ankle. So we did some active, passive, and resisted movements to test range of motion and muscle strength. And then on her knee, we did the same stuff. So just because the lack of knowledge that I had in the first year, I was working more on personal experience, just because back in my days that I used to play basketball, I had too many injuries on my knees and the ankles as well. So I was working more on personal experience and not evidence based that I should do. So there we have the third year placement experience, which is in the Foundation of Light, the football players of under 18. So a group of SRT students were assigned to the Foundation of Light so we could provide healthcare to the athletes. Every Monday we attended the training sessions and we have appointments with the athletes for their injuries, track the process and see if we can speed up the recovery. And then every Wednesday we attend the matches of the teams and we're on the pitch side in case of any injuries. So one of the cases that I had on the third year, this year basically, it's an ACL case. So on the Wednesday match, an athlete from our team was defending and went shoulder to shoulder with an attacker. When he put his foot down, he made a twisting motion leading to ACL injury, and then he fell on the ground in much pain and he could not move his leg. We took him outside the pitch and he went straight to the hospital. So just because I was watching the match, the I saw the mechanism of injury and it was a twisting motion of his leg after a shoulder to shoulder contact that he had with the attacker. This shoulder to shoulder movement was a pretty heavy one because I put too much force, both of them, and then he wanted to stabilize his body, but the thing is that he made this twisting motion that led to an ACL injury, and I ran immediately to the pitch uh, so I can assess it. But the thing is that he couldn't even move his leg, and we just took him to the hospital. So the athlete came at the appointment we had on Monday, next Monday, so I could assess his knee and see how we would move on from there. As soon as he walked in the room, I could observe some things. Thing is that back then, in the first year placement, I wouldn't observe the walking of the patient or any bruising or any swelling that he would have, a patient would have. So as soon as he came in the room, um, he had a knee brace. He couldn't even bear weight on his leg. His knee was swollen. Uh, he looked like he was hurting when walking, but that one was not walking, to be honest. So I started asking the athlete what happened to the hospital, what exactly happened on the pitch, the mechanism of injury, if he felt a deep crack inside his knee, because if you feel a deep crack, maybe a ligament or a muscle could be ruptured or even teared in a third grade. Then I asked for a pain scale while resting, numbness or tingling down his leg for any red flag questions, if he is taking any medication I should know, and if he consumes any alcohol, which he doesn't. So my subjective assessment uh, of the third year is way more specific, as we can see, way more sports related, on football as well, and also just because my knowledge has been growing all over these years. I know what I have to do, I know what I have to ask about a knee injury, obviously, but back then, in the first year, I wouldn't even be able to ask specific questions about the injury, and I would, as I told, I would work basically on personal experience that I had and not evidence based that I should do. So on the objective assessment, um, after the subjective assessment, just because his knee was too swollen, I could not assess it. He was in much pain, and I told the athlete to rest and ice his knee so the swelling goes down and come back on the other Monday so we can assess it properly. He came back on the next Monday, and the swelling was reduced a lot from the last time, and the assessment was basically active, passive, and resistive movements. He was in a bit of pain, and his range of motion uh, was limited because of the swelling. Pain was on palpation was on the anterior and medial aspect of the knee and the back of the knee. Then I did some special tests so I could test the ligaments of the knee, the anterior draw test for the ACL and the PCL. When PCL obviously you're pushing back, and then the valgus tests for the MCL and LCL. So the thing is that I found out on the anterior draw test that his knee was coming out and it was way too relaxed in comparison with his other knee. There was pain over there, obviously, but there was some laxity in his knee. So, difficulties that I had in the first year, the placement case. So just because Greek is my first language and in my first year it was an important communication barrier, combining also the British accent, um, it was a huge barrier for me just because back in Greece I was taught um, American English, and the British accent, oh, I was in shock when I first listened to British accent. Um, I think that due to the lack of knowledge that I had back then, the assessment was not effective, and just because my confidence was not my strong point over the back then, I made the patient feel not confident around me, and I think that's very bad for the therapist. Um, just because of my anxiety that I had back then, I missed a lot of points in the assessment, and more specifically the special tests, which my supervisor came and did the ACL and PCL anterior draw test, and we found out that she had an inflammation or laxity in the PCL. As I told previously, my approach on the injuries was based on personal injuries and experience, just because I used to play basketball and I had many injuries back then, and not evidence based. So how I progressed throughout the years. As time passed and we had more PCPIs coming in, my confidence started growing. My English got improved due to the everyday talking and reading. Uh, I would like to mention as well that I work part-time in a place that a British accent is very common, but I mean the Geordie accent and the Sutherland accent. So I understand the accent as well now on. I started gaining knowledge from practical sessions in the class and studying the modules as should do. My communication skills got massively improved as time passed and handled many PCPI cases. Uh, just because I was talking with PCPIs and other of my colleagues, my communication skills, I can say, indeed, they got massively improved. My approach on sport injuries now is always evidence-based and not based on personal experience. Um, and then patient PCPIs started feeling more confident with me as a sports rehabilitator due to my confidence growth and anxiety reduction. So, how I improved my approach in the ACL injury of the third year placement. I'm saying this because I want to present the differences that I had in the first year and the third year. So the first year I didn't have any knowledge about ACL injuries, just I had only the personal experience. I enhanced my understanding of ACL injuries, let's say the mechanism of injuries. I I studied about the knee anatomy and the ligaments, the bones, the muscles around it. Then I improved my practical assessment skills. As I told, just because of my anxiety, um, I missed a lot of points back then, but now with my confidence growth, um, I'm not missing any points on the objective assessment that we do on the knees, on active movements, passive and resisted as well. So then I gained experience on multidisciplinary collaboration as well. Um, we had some sessions that we worked with medical students, with pharmacy students, with the physiotherapists as well. So that really helped us on gaining even more knowledge, confidence, and to see their approach on injuries or long-term medical conditions, and as well as my other placement is on a chiropractor, so I have another approach of a chiropractor. So um, I have seen many different approaches throughout the years, and I think combining all these approaches is has a very positive effect on me, just because I know how other people see it and how I see it, and I try to combine everything so I can see it in different uh, views. And at the last one, I focused on rehabilitation protocols. Um, goals of the patient in combination with their sport, meaning that I was focusing more on rehabilitation protocols, um, and then I was trying to, as the years passed, um, the first years I was mostly focusing on uh, strength of the joints, but not on balance, let's say. So depending on the patient goals, now on, I'm trying to combine the sport in the rehabilitation. So the rehabilitation plan is designed for their sport, so they can come back and they can return to compete like previously. So the conclusion, in summary, my progression from the first year to the third year of the sports rehabilitation therapy program has transformed my approach to sport injury management. Through dedicated study and practical experience, I have deepened my understanding, explored assessment techniques, and tailored rehabilitation protocols to meet individual needs effectively. Multidisciplinary collaboration has further enriched my perspective, enhancing the quality of care delivered. Looking ahead, I'm committed to continuing my growth and making a meaningful impact in the field of sports rehabilitation. So that was my presentation of showing how I have progressed throughout the years from the first year, the placement case that I had, and also in the final year, the third year that we're going through right now, the ACL case that I had. So, thank you very much.